So an average risk woman is an individual who has no family history or personal history of breast cancer, is not a breast cancer gene carrier, and has not previously had radiation to the chest. In terms of when we recommend that women begin breast cancer screening between the ages of 40 and 49, healthcare professionals will usually speak with women about the pros and cons of screening beginning at that age. For a woman who's aged 50 to 74, we would recommend breast cancer screening with mammograms, typically at every 1 to 2 year intervals. After the age of 75, the recommendations for screening depend on that individual's life expectancy. A moderate risk individual is an individual who has not previously had breast cancer, but has a family member, particularly a first-degree family member who has had breast cancer, but does not carry one of the known breast cancer genes. The recommendations for screening for a moderate risk individual are the same as an average risk individual, and that needs to be very carefully individualized for each person. A high-risk individual is an individual who has previously had breast cancer themselves, or who has a first-degree family member with breast cancer who is a known gene carrier, but that person has not been tested for the gene, or if an individual is a known breast cancer gene carrier, or if they've had chest radiation between the ages of 10 to 30. Chest radiation may have occurred if that individual had had something like Hodgkin's disease in the past. Breast cancer screening for high-risk individuals should include beginning with mammograms annually. Sometimes, in addition to a mammogram, we'll use an ultrasound, and oftentimes those individuals will have MRIs. The age at which those individuals start screening depends on what made them high risk. So for individuals who have a family member who was a gene carrier, we will often start screening at least 10 years prior to the diagnosis of the individual who had previously been diagnosed. Any woman who has a question about when to start screening for breast cancer should meet with their physician or healthcare provider, and that decision should be individualized for that person.